Welcome to Let's Talk Lupus. Many patients wonder, what is lupus remission? How do I know when I'm in it? Well, Dr. Levy is here to discuss that very fact in this month's edition of Let's Talk Lupus.
So the term remission really comes from the cancer world. Remission there means that we can't find any signs of the disease. Remission is really different from cure, which has also been defined in the cancer world as being remission for some long period of time, usually about 5 years. So if we think about lupus, obviously it's very different from cancer, and the terminology that we use can be quite confusing. Active disease or lupus flare, that's when we see symptoms. For example, a rash, swollen joints, hair falling out. We also look for signs, such as protein in the urine or low blood cell counts, or high antibody or protein levels. Inactive or quiescent disease, that's when there are no symptoms, and mostly normal blood tests and urine tests. When someone is in inactive disease, there may still be some abnormal blood tests, but they really are stable and they're not worsening over time. So when you hit this state of inactive disease, then that person who has lupus may still be taking medications, but we've been able to control that disease so that it is quiet. So after some period of inactive disease, usually several months, we could say that we have reached remission. Again, this is a bit tricky terminology since this remission could be in someone who's still taking a lot of medication. So we tend to call this remission on medication. Patients often think of remission as, well, remission off medication. I'm totally fine and I'm not taking any medicines. That's remission. In other words, there's really no signs of active lupus. However, for us, the lupus doctors, well, we think that you can still be in remission off medication and be taking the medication called hydroxychloroquine. Really, most of us wouldn't stop that medicine even when the lupus is quiet. So I guess to simplify it further, we would consider remission when the disease is dormant or sleeping, and you're either taking medications or you're not taking medications. So understandably, we don't see remission off of all medications in every person who has lupus, but certainly we're always aiming to reach that target.